Hi, I'm Rich Daly, and this is Fast Finance, your quick hit of the news and numbers that matter in healthcare finance. Up first, weird numbers. These are some random healthcare numbers that recently caught our eye, and today's weird number is 20. That's the number of states that have enacted mandatory minimum income limits for free or discounted care. Now for today's main story. Unions are gearing up for a bigger push on physician organizing, according to an annual tracking report. A leading healthcare union for interns, residents, and fellows increased its membership from 17,000 in 2021 to more than 40,000 last year. That's according to the Union Activity Report from the American Society for Healthcare Human Resources Administration, or ASHRA. The physician organizing push includes the May 2025 launch of a new SEIU organization called Doctors United, and a national strategy for leveraging resident and fellow union members to promote post-residency and attending physician organizing. That's according to Chris Cimino, CEO of Chessboard Consulting and author of the ASHRA report.
They appear to be lining themselves up to really focus on physician organizing, pre-organizing these folks when they're even in medical school, through residency, and then trying to leverage their gains because of course residents, they graduate, right? And that's the troubling thing, where we've had all this organizing among residents.
Currently, only about 8% of attending physicians are unionized.
They're a critical part of the care delivery model, and patients depend on them. And that's why I think there's such an urgency here to boost engagement and try to prevent and avoid large numbers of our physicians, attending physicians, from getting swept up into this notion that the only way to get what you want is through conflict, right?
Unions have increased their appeal to physicians because those representing interns, residents, and fellows have succeeded in negotiating contracts, providing new members with higher pay and improved working conditions. That's according to Cimino. Overall, healthcare union elections decreased 24% to 280 in 2025. That's down from 369 in 2024. However, labor's win rate in healthcare elections increased from 77% to 89% last year. There were 51 healthcare strikes called by unions in 2025. That was an increase from 31 in 24. And that 2025 healthcare strike increase came amid a decrease in overall labor strikes across all industries last year. Like other types of clinicians, physician unionization and strikes primarily are fueled by their perception that these healthcare professionals have no voice in their organization, according to Cimino. An example of an effective approach countering that push is organizations that obtain a magnet designation from the American Nurses Credentialing Center, according to Cimino. That certification program includes requirements that organizations embed nurses in decision-making roles, such as on unit-based committees that determine how care is delivered.
To me, that's kind of the gold standard, right, for employee involvement, where nurses sit on these unit-based committees and they actually participate in decision-making that affects their clinical practice. And in my way of thinking, that is really what you want. You want the mechanisms that allow the staff to participate in decision-making, that allow the staff to provide meaningful input.
Expect more union activity in healthcare this year, and perhaps more organizations undertaking preventative policy changes. And now, before we go, just one more thing. Hospitals recently urged CMS to withdraw proposed rules aimed at barring sex-rejecting procedures on children, while others warned about the costs. Several healthcare groups raised objections to the two proposed rules from CMS. Those would, one, add a ban on quote unquote sex rejecting procedures on children to Medicare's conditions of participation. And 2, bar Medicaid and the Children's Health Insurance Program from paying for such procedures. Hospital revenue was estimated by CMS to decrease under the Medicare Conditions of Participation rule by $53 million over 10 years, and provider revenue would decrease by $318 million also over 10 years under the Medicaid and CHIP rule. A group of attorneys general from 20 Democrat-led states and the District of Columbia wrote to CMS that the agency quote-unquote woefully underestimates hospitals' financial losses from the proposed rules. Well, that's all we got for today. Don't forget, you can get the Fast Finance newsletter delivered right to your inbox. That's every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.